161. Standard precautions apply only to patients with visible wounds. True or false? Answer: false. Rationale: standard precautions apply to all patients to prevent transmission of pathogens via blood, body fluids, or mucous membranes, regardless of visible wounds, per CDC guidelines. 162. The nurse should lock wheelchair brakes before transferring a patient. True or false? Answer: true. Rationale: locking wheelchair brakes ensures stability during transfers, preventing falls and ensuring patient safety, per safe patient handling protocols. 163. Vital signs should be taken only when the patient is symptomatic. True or false? Answer: false. Rationale: vital signs should be taken routinely as ordered or based on protocol, not only when symptomatic, to establish baselines and detect changes, per assessment standards. 164. Proper positioning includes supporting a patient's limbs with pillows. True or false? Answer: true. Rationale: supporting limbs with pillows maintains alignment, reduces pressure, and enhances comfort, especially for mobile patients, per nursing care standards. 165. A pulse rate of 120 beats per minute is normal for an adult at rest. True or false? Answer: false. Rationale: a pulse rate of 120 beats per minute is above the normal range, 60 to 100 beats per minute, for an adult at rest, indicating tachycardia, requiring assessment. 166. Strict intake and output monitoring is required for all hospitalized patients. True or false? Answer: false. Rationale: strict intake and output monitoring is required for patients with conditions like renal failure or fluid overload, but not all patients, based on clinical need, per nursing protocols. 167. The nurse should document medication administration before giving the dose. True or false? Answer: false. Rationale: documentation should occur after medication administration to ensure accuracy and confirm the dose was given, per legal and charting standards. 168. Guided imagery is a non-pharmacological comfort measure for anxiety. True or false? Answer: true. Rationale: guided imagery uses visualization to reduce anxiety and promote relaxation, serving as an effective non-pharmacological comfort measure, per holistic care principles. 169. Nurses can ignore a patient's cultural dietary restrictions. True or false? Answer: false. Rationale: nurses must respect cultural dietary restrictions to provide patient-centered care and build trust, coordinating with dietitians as needed, per ANA standards. 170. The nurse should report suspected patient neglect to authorities. True or false? Answer: true. Rationale: nurses are mandated reporters and must report suspected neglect to authorities, ensuring patient safety, per state laws and ethical obligations. 171. Airborne precautions are required for Clostridium difficile infections. True or false? Answer: false. Rationale: Clostridium difficile requires contact precautions, not airborne, as it spreads via fecal-oral transmission, per CDC infection control guidelines. 172. A temperature of 37.0 degrees Celsius is considered febrile. True or false? Answer: false. Rationale: a temperature of 37.0 degrees Celsius is within the normal range, 36 to 38 degrees Celsius. Fever is defined as 38 degrees Celsius or higher, requiring further assessment, per fever management guidelines. 173. Sequential compression devices are used for all surgical patients. True or false? Answer: false. Rationale: sequential compression devices are used for surgical patients at risk for deep vein thrombosis, not all patients, based on risk assessment, per postoperative care protocols. 174. The nurse should assess pain using only verbal reports from the patient. True or false? Answer: false. Rationale: pain assessment includes verbal reports, nonverbal cues, e.g., grimacing, and behavioral changes, especially for nonverbal patients, per pain management standards. 175. Nurses are responsible for verifying the accuracy of physician orders. True or false? Answer: true. Rationale: nurses must verify physician orders for clarity, appropriateness, and safety, questioning discrepancies to prevent errors, per nursing practice standards. 176. A respiratory rate of 30 breaths per minute is normal for an adult at rest. True or false? Answer. False. Rationale. A respiratory rate of 30 breaths per minute is above the normal range, 12 to 20 breaths per minute, for an adult at rest, indicating tachypnea, requiring assessment. 177. Hand hygiene is required after removing gloves. True or false? Answer. True. Rationale. Hand hygiene after glove removal removes potential pathogens from hands, as gloves may have microtears, per CDC infection control guidelines. 178. The nurse should assist a patient with ambulation only after surgery. True or false? Answer. False. Rationale. Ambulation assistance is needed for any patient with mobility issues, not only post-surgery, to prevent falls and promote independence, per safety protocols. 179. All patient assessments should be documented in the medical record. True or false? Answer. True. Rationale. All assessments must be documented to ensure continuity of care, support clinical decisions, and meet legal requirements, per charting standards. 180. Hypokalemia can cause constipation and fatigue. True or false? Answer. True. Rationale. Hypokalemia, low potassium, impairs muscle function, including gastrointestinal motility, causing constipation and fatigue, requiring electrolyte correction. 181. Medications can be left at the patient's bedside for self-administration. True or false? Answer. False. Rationale. Medications must be administered by the nurse to ensure safety and compliance, not left at the bedside, except in specific self-administration programs, per safety protocols. 182. Elevating the head of the bed improves breathing in patients with dyspnea. True or false? Answer. True. Rationale. Elevating the head of the bed to 30 to 45 degrees facilitates lung expansion and reduces dyspnea, per respiratory care standards. 183. Therapeutic communication includes using medical jargon with patients. True or false? Answer. False. Rationale. Therapeutic communication uses clear, simple language to ensure patient understanding, avoiding medical jargon, per communication principles. 184. A cold pack is contraindicated for chronic pain. True or false? Answer. False. Rationale. Cold packs can be used for chronic pain in some cases, e.g., inflammation, though heat is often preferred, depending on the condition, per pain management guidelines. 185. Nurses can delegate patient assessments to unlicensed assistive personnel. True or false? Answer. False. Rationale. Patient assessments require nursing judgment and cannot be delegated to unlicensed assistive personnel, per scope of practice and safety standards. 186. Cultural competence includes respecting a patient's spiritual practices. True or false? Answer. True. Rationale. Respecting spiritual practices is part of cultural competence, ensuring holistic, patient-centered care and fostering trust, per ANA standards. 187. A heart rate of 80 beats per minute is normal for an adult at rest. True or false? Answer. True. Rationale. A heart rate of 80 beats per minute is within the normal range, 60 to 100 beats per minute, for an adult at rest, indicating stable cardiac function. 188. The nurse should administer medications without checking the expiration date. True or false? Answer. False. Rationale. Checking the expiration date ensures medication safety and efficacy, preventing administration of ineffective or harmful drugs, per medication safety protocols. 189. Proper hand hygiene includes using soap and water for visibly soiled hands. True or false? Answer. True. Rationale. Soap and water are required for visibly soiled hands to physically remove dirt and pathogens, as hand sanitizer is less effective, per CDC guidelines. 190. Incident reports are used to document routine patient care. True or false? Answer. False. Rationale. Incident reports are for unexpected events or errors, not routine care, to analyze risks and improve safety, per facility and quality improvement standards. 191. Droplet precautions require a mask only during procedures. True or false? Answer. False. Rationale. Droplet precautions require a mask during close contact, within 3 to 6 feet, with the patient, not only during procedures, to prevent transmission, per CDC guidelines. 192. Fluid balance can be assessed by checking skin turgor. True or false? Answer: true. Rationale. Poor skin turgor indicates dehydration, a key assessment for fluid balance, along with other signs like mucous membrane dryness, per nursing protocols. 193. Nurses can modify a patient's diet without a physician's order. True or false? Answer: false. Rationale. Diet modifications require a physician's or dietitian's order to ensure medical appropriateness, with nurses coordinating and educating, per care standards. 194. A warm compress can relieve muscle spasms. True or false? Answer: true. Rationale. A warm compress promotes muscle relaxation and blood flow, relieving spasms as a non-pharmacological comfort measure, per pain management guidelines. 195. Nurses are responsible for ensuring a patient's informed consent is documented. True or false? Answer: true. Rationale. Nurses verify that informed consent is documented before procedures, ensuring ethical practice, though the provider obtains the consent, per standards. 196. A respiratory rate of 10 breaths per minute is normal for an adult at rest. True or false? Answer: false. Rationale. A respiratory rate of 10 breaths per minute is below the normal range, 12 to 20 breaths per minute, for an adult at rest, indicating bradypnea, requiring assessment. 197. Hand hygiene is required only before patient contact. True or false? Answer: false. Rationale. Hand hygiene is required before and after patient contact, before aseptic tasks, and after exposure risks, per WHO and CDC infection control guidelines. 198. The nurse should use a draw sheet only for incontinent patients. True or false? Answer: false. Rationale. A draw sheet is used for repositioning any immobile patient, not only incontinent ones, to reduce friction and prevent skin injury, per safe handling protocols. 199. Pain management includes reassessing pain after interventions. True or false? Answer: true. Rationale. Reassessing pain after interventions evaluates effectiveness and guides further treatment, ensuring optimal pain control, per pain management standards. 200. Advance directives are legally binding in all situations. True or false? Answer: false. Rationale. Advance directives guide care but may not be binding in all situations, e.g., unclear wishes or emergencies, requiring team consultation, per legal standards.